So first of all, I want to thank you all for taking the time, especially at the end of your day, to join this session. It's good to have you all on the same screen, even though you all are working in food banking in the same country. I know that there is some level of unfamiliarity among you about the different programs that you're doing and the kind of the organizations that you each represent. And so we wanted to have our first session, first of what I hope will be a series of sessions with you, to just focus on the opportunity for you to chat with each other and share the experiences and the work that each of your organizations are doing. And of course, understanding that what you do today is in many cases quite different from what you were doing 8 months ago or 9 months ago, before COVID struck and things went into lockdown in March and have evolved as they've evolved since then. So we're really going to just focus this agenda on you talking with each other, with the exception that we're going to hear from Emily Broad-Leib from Harvard Law School. Some of you met her when she was in India with a colleague last year. And I'm going to let Doug take just a quick minute to do an introduction of Emily and the project that we are working on with her and her team at Harvard Law School. Doug, over to you.
Great. Thank you, Chris, and thank you all. Our friends and colleagues in India. I don't want to belabor the introduction. Just needless to say that Emily Broad-Leib, the executive director of the Harvard Law Food Law and Policy Clinic, has been a great friend to GFN. She's working on the second year of a project to identify 15 countries, to work on the food donation policies that include liability, labeling, tax incentives in 15 countries, and we're right now pending for a second round. India was one of those first round countries, and we've got some phenomenally good, high quality analysis of the legal situation that affects food donations in India. And we're asking Emily to come forward and talk about those findings. And then hopefully we can have a dialogue about how we can advance some of those recommendations forward in the current context. So without any more introduction from me, Emily, I turn over to you.
Thank you. It's so good to see everyone, and to see, I see Jomi there again. I know I see Vandana's name. Good to get to speak again, and I know Srishti's not on yet, but it was such an amazing experience getting to meet and work with many of you in January. I want to briefly say that Ariel, who many of you met, who is my colleague, she still works with us, but she's moving on to help finish up some of the other countries, and then is doing some other work really on domestic food security. But I'm excited to introduce Esther Acqui, who, Esther, do you want to just say a quick hello so everyone can get to know you as well?
Hi, everyone. My name is Esther Acqui, and I'm a clinical fellow with the Harvard Food and Policy Clinic. And I recently joined the Atlas Project, currently working on South Africa, but looking forward to working with the India team as well.
So I asked Esther to join because I'm hoping that if there's an opportunity for us to continue working with you all on pushing forward some of these policies and systems level changes, that Esther can help out with that. But Ariel also sends her regards, as do the two students who were with us when we were in India, Taylor and Kelly. So for those that we didn't get to meet, the Global Food Donation Policy Atlas is a project that really uses research around the laws. And we're, as Doug just said, for the first 2 years of the project, we're looking in 15 different countries. The year one countries that we've completed already were the US, India, Argentina, Mexico, and Canada. And in a moment, I'll share my screen for a second and show you a little bit of the Atlas map so you can see how we're displaying this information. And the project really gives us an opportunity to for each country provide first a legal guide to the current laws in that country. And the idea behind that was really to put all of the laws in one place so that for all of you and for colleagues just doing work like yours in other countries and businesses and government, it's really a document that says, here are what the current laws are. We've actually found from our experience in the US, we've done a lot of this work in the states around the US, just helping describe the laws. So especially as there's more of a focus on food waste and food donation and food security, these questions come up over and over about, well, do we have a tax incentive or a penalty? And are we allowed to donate food that's after the date label? What kind of food safety laws do we need to follow for donated food? So our goal was really to put that into one document for each country. Then the second product for each country is a set of recommendations. And these really were developed from our visit there. And then I know we spoke with a couple other folks on this call that we didn't get to meet while we were there, but really to understand what are the barriers amongst these laws, which are the ones that are a priority for this country. And those really vary from country to country, even if in certain countries the laws are equally, could be strengthened in the same area. We really focused on prioritizing the things that we heard from our partners. And then the next piece was this website, which I'll share in just a moment so that we could start to compare across countries and give an opportunity. So for example, if there's a law, an area of law where it seems like India could make progress, that you could kind of see what is the gold standard in that area, what other countries have done something that food banks in that country say has worked really well, that could be a model for what might work. And then lastly, we're supposed to be doing a summit, which was supposed to be in June and has been postponed, but we are hopeful that we're going to get another round of this grant and that we'll be able to host that summit here at Harvard at some point post-COVID. But in the meantime, we will be doing a series of webinars over the coming months on some of the topics that we've learned. And the first one will be really focused on food donation during COVID, and will be in January. And then lastly, as our next phase of the project, we're also hoping to go back and select some of the countries we worked with in the first 2 years to do more direct technical assistance around implementation. So we know that when we finish the guide and the recommendations and turn them over to all of you, it's kind of a lot of information. So what we're hoping to do is work with countries to really prioritize one or two things from them, and then help however we can on doing, helping draft the laws, helping do presentations or build coalitions or whatever would be most helpful to move something along and help you make progress. So with that, let me just briefly share my screen so you can see the map. Okay. Yeah. So this is all on our Atlas website, and the site has a bunch of other materials. There's a library where you can find all the documents for different countries. But I think the piece that's really helpful is this Atlas, which you can get to either from the homepage or just by clicking on Atlas. So here you can see right now there's only 5 countries on there, but by March there will be 10 additional countries. The ones that are in dark gray will be added. So Esther mentioned she's working right now in South Africa. We're looking in the UK and in France and some other countries in Latin America. And what you can see is when you select different policy areas, countries will light up with how good we think that their policy was. So for food safety for donations, this was one actually because of the new surplus food regulations that the FSSAI put out in India. We thought it was actually one of the models of a food safety agency actually caring about food waste and really putting some guidance out. So in most countries, the US included, there's nothing like that. Like our food safety agencies really don't mention food donation anywhere. If you look on date labeling, you'll also see this is one, actually we didn't have any country that we thought was green, which is a strong policy, but we thought in India, at least there's some clarity around the different date labels that can be used. And then we made some further recommendations, in particular for India, about making it easier to donate food if it's before that best before date that's meant to be about quality. In terms of liability protection, here's one that I think came up in a lot of the conversations we had with all of you. So as you can see, in so far of the countries we've looked at, the US and Argentina had quite strong liability protections for donors of food. And then Canada and Mexico both had something in place, but we thought could be stronger. So for example, in Canada, there's no national level protection, but every single province in Canada does offer that protection. So we thought they could just make it stronger by, making that national. But as you all know, in India, there's no policy that protects donors of food, even if they follow all the safety rules and they do everything correctly. So that was something that came up in a lot of conversations. Tax incentives is another one that came up in our conversations with many of you. Right now in India, for companies or businesses that donate food, there's no tax credit or deduction or other economic incentive that they can claim for the donation of that food. Even the CSR incentive, the CSR requirement doesn't technically apply for food businesses donating food. Tax barriers, seems like there's not really a barrier right now. This often is the case in countries where the donation of food is itself considered to be a taxable event, and therefore someone's responsible for paying tax on that food. The only country so far in our set that has had that issue has been Argentina, and it's not an issue in India. Donation requirements of food waste penalties. We've seen in all of North America, nothing at the national level, but there are a lot of provincial or state level restrictions that really restrict the amount of food that businesses can throw away. And what we've seen, for example, in Massachusetts, where I live, that there was a 22% increase in food donation. And in Vermont, there was a 60% increase in food donation just by banning healthy, edible food from being thrown away. And then lastly, in terms of government grants and incentives, this was another one that came up in many of our conversations in India. So this would be grants or incentives to support the infrastructure for food donations or to provide other types of incentives. So some of the companies we spoke to in India had said, even right now, there's not even like a recognition or an award or anything like that comes along with businesses donating food. That right now they're all just doing it out of goodwill, but not getting any economic or other incentive, and that could be a driver. So the last thing to say here is if you also click on India on any of those, you'll be able to scroll through all of just a very brief statement of the policy and why we think it is a strong or weak policy within India. So, okay. I think I'm trying to stop sharing, but I don't know why it's saying just resume share. I'll stop share. Okay, cool. Sorry about that. So I think I'll leave it there. I'll just say that, our goal from here is really to do whatever we can to make it easy for you to use this. So if there's any follow-up we could do through further discussion with this full group or with any one of your organizations, we'd love to do that. And we're just excited to be helping move things forward. It was such a huge, disappointment that right after we returned, after COVID spread, I felt like we weren't able to really, have the big bang with like putting out some of this information that we'd hoped. And we're hoping that we can find ways with every one of the countries we've worked with to be able to do that. So we're grateful to GFN for partnering with us and organizing this and inviting us to come reconnect with all of you. Turn it back to you.
Great. Thanks, Emily. We do have just a couple minutes. If anybody has a question for Emily, we can take one or two questions. If you do have a question, just unmute your microphone and you can jump in. Okay, and hearing none, you're off the hot seat. Thanks, Emily. We appreciate it. So, so now we're going to go through a series of brief presentations. You each have, each organization has about 10 minutes, and we have 5 organizations participating in the session. So we're going to just take them alphabetically by organization name. So we're going to start off with Anahin People's Charitable Trust in Ahmedabad, Gujarat. And Tushar Sankala is representing Anahin here in the session. And so we're going to turn it over to Tushar to talk to us about the work that Anahin's doing.
Hi, everyone. It's great to see you. I hope I'm audible.
Yes, you are.
Great. Then I'll carry on from here. So, Annahin People's Charitable Trust actually came into existence thanks to GFN after we met Chris. Earlier, me and Jaishil, we both have started this organization. We were volunteers with Robin Hood Army, and we were handling the Ahmedabad chapter for that organization. But then we were introduced to Chris and the entire GFN project by the government of Gujarat, where they had met earlier in Chicago. So from there, we had started a conversation. Chris explained us how the food banking works internationally, and then we came to know about things. And since Robin Hood Army is a non-cash organization, we had to work out an option where basically an entity was needed, a legal entity was needed. So Annahin came into existence because of that. And so for the past 1 year, just got registered in September 2019. And we were actually waiting for certification when the COVID came and the lockdowns came out. So our government certification for taxations were pending, which we recently got in September this year. So there have not been much donations, unfortunately, in terms of getting our project, which has been delayed a lot. In Chris's last visit to India, there was a good momentum that we had at that time to get things off the ground. But unfortunately, due to this, it has been delayed quite a lot. So that is where we stand right now. During COVID, but we had a good response from people in terms of donations. We shifted our modus operandi to not wait for just cash donations, and even take in direct food donations, or arrange directly with the Robin Hood Army rather than diverting it through us. So we did good. We did cover quite a lot of ground at that time. A lot of necessity arose out of the blue because of that. We were able to manage a lot of food kits for people. Instead of just getting them food ready, what we did was we prepared kits, basically the staple diet of any Indian family that came. We made a list of all those 5-7 items and provided it to the family for 2 weeks. So that way we covered more than 5,000 families during a period of 1 month that way. Now, post COVID, we have got all of our certifications in order. So we are good to go and going ahead. Now we have started approaching the corporate companies which have their head office in Ahmedabad starting with. And in collaboration with Robin Hood Army, we are getting some good national tie-ups as well. Recently, we did a tie-up with Akshay Patra Foundation, which is an organization which works dedicatedly only for food distribution in India. Their primary goal was first midday meal program for school kids, but after COVID, due to the schools not being operational, they had diverted some of their funds to just providing meals to other people. So we did a 2 month run with them, which just recently ended before Diwali. So this way we are starting to get collaborations and good responses from people. But since it is a new project, the entire idea of food bank actually working, how we work, we are also learning on the go, and we are also educating the donors that we come across on the go as we go, because the entire concept is new to the city of how food banks work actually. That is it from my side.
Okay, Tushar, thank you very much. We're going to suggest holding questions, but please make note of any questions you have as you listen to each other talking. But rather than dealing with questions after each presentation, we think that it will be more effective to make sure that we get through all of the presentations if we hold questions until the end. And then we will have a period that we can come back and chat with each other about things that we wanted to get some clarity about or whatever. So thank you. And now we'll move on to Bangalore Food Bank, and that will be Jomi Joseph. and Jomi will share what's been going on at Bangalore Food Bank and where they're headed. Over to you, Jomi.
Thank you, Chris. Hi, everyone. This is Jomi here from Bangalore Food Bank. I'll just take you through our organization. We started our operation in Bangalore on World Food Day, that is 16th of October 2014. And we registered our organization as Feeding Bangalore Foundation on 24th of the same year under Section 8 of Companies Act. So our major objective was to address the issues of hunger, malnutrition, and to prevent food wastage. So the organization was started by Mr. Syamogan, the previous director of Griffith Food, which is one of the founder partner of Bangalore Food Bank, along with GT, another MNC who founded this organization. So Syamohan had an opportunity to interact with global food banking and able to understand its objective, operation, and various welfare programs, which inspired him to start a food bank in Bangalore too. So that was the background how we started our organization in Bangalore. So we have a vision to eradicate hunger, malnutrition, and to prevent food wastage. And for that, we have missions. We have created a supportive environment where the donor and the beneficiaries that will come to a common platform. So Bangalore Food Bank will act as a system that will connect the donor and the beneficiaries through various organizations. So obviously, we serve the needy with clean, sufficient, nutritious, healthy food. And to procure more food, we started receiving fund also to purchase and provide to the needy. On the other hand, we started working for food wastage also, where we meet various corporates through our network and directly and identify the source of surplus food that is actually going to landfill, and we rescue that and will give it to the needy people through a network of 28 active NGOs across Bangalore. So how we or what we do? So we mainly have 4 programs. That is one NGO feeding program where we supply essential groceries to NGOs running residential programs. So currently, I mean, pre-COVID, actually, we were supporting 8 organizations running residential programs by supplying monthly groceries to them. So our objective is to ensure that all our beneficiary organization will focus maximum to their core area, and the inmates will meet their daily bread through our program. So that was our idea. So 2 objectives actually we defined here. That is, one, to serve the people, inmates, with daily bread, and to improve their quality of life or quality of service actually that organization is providing to them. Another program is food rescue program, where we rescue surplus food, and currently we rescue 3 to 4 tons of surplus food every month from various corporates and donors, and we distribute it to the needy people through a network of around 28 active NGOs across Bangalore. And we do have a breakfast feeding program, which is intended to serve the kids, I mean the school kids. Currently we serve, we are serving in 2 schools, benefiting 486 students. And food relief program, of course, disasters are not nowadays a common thing. So we were active during Kerala and Karnataka flood in 2018 and 19. And 2020, actually, we with that experience in 2020, we could implement a good organized relief program during the COVID. So our impact during COVID. So we have come up with a program where we supply essential groceries to the needy families who lost their job or reduce their income and who are not able to manage their daily nutritional needs. So we came up with essential groceries in a kit, and so far we have distributed 7,500 families across Bangalore. Uh, so it was contributed thanks to IFB and GFN for contributing towards this program. With your help, we were able to uh, supply more than 82 tons of essential groceries to these needy families. And we were also distributing cooked meals during the beginning of our lockdown, were to the people who were not having cooking facility, especially urban homeless. Then later we stopped as we identified that the cooking food, one thing it is costly, and second thing it has to consume in a day. So and also there were many other players in the on the ground who are distributing. So that's why we focused towards grocery and continue now. Also, we have we have adopted 8 new NGOs running residential programs. So under our NGO feeding program, because a lot of NGOs actually they came up with requests that due to the situation they are not able to manage their uh, food requirement, because one thing corporate there was a shift from the regular program to relief work. That was one reason, and other thing, most of these NGOs were getting a lot of small contributions through visitors, which is completely stopped due to this COVID. And of course, we resumed school feeding program by supporting nutritional kit to the beneficiaries. Instead of serving the cooked meals, what we planned, we served nutritional kit, that is dry ration, to the schools once in a quarter. So the first distribution to our 2 schools we have completed. So our goal, actually it is the plan post-COVID. In fact, I don't know whether I can say post-COVID. So anyhow, for 2021, our goal is to reach 3 million, to serve 3 million feeds to the needy. So, uh, so our breakup will be through under our breakfast feeding program. We are targeting close to 500,000 feeds. So our plan is, as of now, we hope that schools will be opening. If it is not opening, then of course we will plan to make it reach to the kids through schools or directly to the home. So we are widening this program because we know the importance of a school feeding program and the scenario demand for a healthy diet, which will boost their immune system. And of course, our NGO feeding program, we already realized that there is a lot of requirement for NGOs who are running residential programs. So we are going to add 5,000 more beneficiaries, and they will be contributing approximately 1.3 million feeds through the entire year, coming year. And of course, the food rescue program, which is already there, that of course we are expecting to procure a minimum of 70 tons during 2021. And a food relief program, we will be continuing till December. Till next month, we will be continuing, and then we will take a call whether how to continue this, whether we should continue as a ration kit or should come up with some other kind of aids that will benefit based on the situation on ground. So, so along with this, we are widening our team with one resource mobilization person exclusively to bring more resources to the Programs also, we are planning to add one more human power to our programs. So that is all about Bangalore Food Bank. So now if you have any questions, then of course you can note it down and can ask me later. Thank you all.
Okay, thank you, Jomi. We appreciate it. We're going to move now to the India Food Banking Network, and Vandana Singh, who is CEO of IFBN, is going to share about what's going on with IFBN. Vandana, over to you. Oh, I think we have a tech issue.
Himansh, yeah.
Here we go. Okay.
So you can just show this slide, yeah? Okay. So India Food Banking Network, we were established in 2011. Himanshi, if you could just go to the 4th or 5th slide. Himanshu, can you hear me? Hello?
We can hear you, Vandana.
But Himanshu cannot hear me. Himanshu? Okay, let me see if I can.
Hello. Yeah, ma'am, I can hear you.
Can you just go to the 4th slide, the India Food Banking Network? 5th slide?
Yes, ma'am, I'm on the 4th slide. Yes.
But I cannot see it on my screen.
Yeah.
Okay. Yes. And down. Okay, we'll leave. Okay, leave it then. So India Food Banking Network was set up in 2011 in response to the challenges of high levels of hunger and malnutrition on one hand and the significant levels of food wastage on the other. Currently, we are present in 32 locations, reaching out to through 150 NGO partners to over 1.5 million individual beneficiaries, including underprivileged children, women and elderly, daily wagers, and migrants. Our strategy has been to create and strengthen food banks in India in local communities. And this we have been doing through multi-stakeholder partnerships to systematically capture and distribute food to address hunger and malnutrition. The IFBN advantage has been that we have been an aggregator and an enabler. We have adopted the strategy of scaling up impact through partnerships. The idea is to bring together key stakeholders and enable our partners to leverage their capabilities. So if you will see that we have been working with the other partners whom you have already heard from also and are going to hear, like we work with the Bangalore Food Bank. We are working with No Food Waste, whom you will be hearing soon, Padmanabhan. And we also work with Robin Hood Army in Cochin and Ernakulam, and we have worked with the Feeding India also in some areas. So what we've been trying to do is that we've been partnering with NGOs, with corporates, with other feeding organizations like us, and trying to build up these partnerships so that we can leverage our strengths and scale up the impact. We've had basically two models. One is channeling packaged food and the other is the school nutrition program. And We also working on the emergency food assistance, especially since COVID started, which was, the lockdowns and the challenges with the daily wages and the unorganized sector started from March 2020. So if you will see, our first model has been that IFBN partners with food companies to save food and channelize their surplus products to feed those in need. So IFBN and its food banking partners play an end-to-end role. We pick up the surplus from the food companies or good quality packaged food inventory, and then we distribute it. This has a big impact of utilizing the surplus packaged food, feeds those in need, provides the food businesses access to a national network of feeding programs, reduces food waste. We work with all the top companies, Britannia, Nestle, Mondelez, ITC, Hindustan Unilever, and everybody. And for this also, we have been partnering with the other feeding programs like No Food Waste, Robin Hood Army, and some of the other organizations, Bangalore Food Bank, etc. The second model, where we have been providing cooked nutritious meals to children in school nutrition programs. These daily in-school hot nutritious meals provided to the students throughout the year has been providing vital nourishment, helping to keep the children in school and also improving their growth and learning outcomes. Various corporates under their CSR support us with these school nutrition programs, and we reach out to different schools, children in schools for the school nutrition program. We work also with Bangalore Food Bank, and we have been supporting one of their partner organizations with 300 children daily meals for the last 3 years. And then response to the COVID-19 food crisis. IFBN has been providing emergency food assistance to daily wagers and their families who are in distress due to loss of jobs. We have been partnering with corporates under their CSR programs to provide emergency food assistance comprising of staples and groceries, including rice, wheat, flour, pulses, cooking oil, and spices. Between April 2020 and September, IFBN has distributed 300 metric tons of emergency food relief, food ration kits, and this has helped vulnerable families to access food, stay healthy, and rebuild their lives. So, as I have been stressing, that partnerships have been the key to our functioning. We have, for the food banks, for the setting up of the food banks also, we have partnered with different organizations and individuals of network of motivated organizations and leaders who are all inspired by the same mission and who bring together their wisdom and resources. So it could be under corporate CSR. We have partnered with Rotary clubs, Lions clubs, a number of NGOs, and civil society. We have been partnering with corporates for the various programs, whether it is for the distribution of packaged products, for the school nutrition programs, and then for the emergency food assistance for distribution of ration kits. Then we've been partnering with the corporates for their product donations. So like I told you that we have partnered with corporate food companies. The biggest food companies are all there. Hindustan Unilever, Mondelez, Britannia, ITC, Hershey, PepsiCo, Nestle, and many others. Then we've been partnering with a number of industry bodies for advocacy and creating an enabling ecosystem. We are a member of the CII Nutrition Committee. We work with FIC, the Federation of Indian Chamber of Commerce and Industry, the FACE, FSSAI, the Food Safety and Standards Authority of India, the Ministry of Food Processing Industry, and yes, of course, Global Food Banking Network. So we think we are stronger when we work together, because together we can combine and leverage our efforts and resources and create a joint impact much greater than what organizations can achieve acting alone. So through these collaborations, we have been able to scale up impact Just during these last 8 months, during the COVID relief, we have distributed 500 metric tons of packaged food products and 335 metric tons to 40,000 families. We've distributed ration kits. The distribution network has spread over to 32 locations. If you'll see, in this is also included some of the areas where we partner with No Food Waste, and Bangalore Food Bank, and Robin Hood Army in Cochin and Ernakulam. So through these various partnerships, we are present in 32 locations where we have distributed these packaged products and ration kits, and also the school nutrition program. We have over 200 corporate partners and NGOs in all these 32 locations through whom we reach out to the actual needy in the society, because these are the organizations who provide us the resources, and on the other hand are the NGOs who are actually working in the community and know who the most needy are. So therefore, collaborations are central to our working. They help us to achieve scale, and we believe it will help us to move the needle on hunger and malnutrition. That's all. Thank you.
Thank you, Vandana. We appreciate you walking us through all of that. There's a lot of information there. Next, sorry, I'm having my own tech issues here with my phone. Next on the list is No Food Waste, based down in Coimbatore, and Padmanabhan Gopalan is going to share about the work of No Food Waste. Padmanabhan?
Hello everyone, happy to meet you all. Hope all of you are safe, and currently we are in Tamil Nadu. We are having a flood alert for tomorrow, so I am not sure what is going to happen tomorrow due to heavy rains. Otherwise, we are all doing well with COVID. We are all used to it now, and we are trying to trying to make our volunteers and our public as safe as possible, working with the government. So No Food Waste is a youth-run organization which started its operation from October 16 World Food Day in 2014, but we were legally registered as a non-profit organization from 2015, and it's almost 6 years. And the core work was, as discussed, the core work before COVID-19 pandemic was in 4 different ways. One is the surplus food collection network that we had in all the cities, collection of surplus food from weddings, restaurants, and individual ceremonies that happened in different cities. And the second work what we have been doing was emergency food assistance during disasters and natural calamities. So it might be during Chennai flood relief and Kerala flood relief, and we have worked in Nilgiris landslides. So when natural calamities or disasters are occurring in the cities where we operate or nearby it, we set up temporary kitchens and immediately form a rescue team and provide food assistance, which will be the most need of the hour to the people who are affected. So, and the third thing is we regularly visit hunger mapping. We do survey of hunger mapping in the cities where we work. We work with volunteers to do hunger mapping. And the fourth thing was awareness. So these are the 4 different activities that we were keenly involved before COVID-19 pandemic. And the impact, we have been operational in 12 cities, mostly in Tamil Nadu, Andhra and Telangana. Most of the cities in Tamil Nadu, other few cities in Andhra and Telangana. The surplus food distribution and collection is around 1.8 million plates per year on an average. So which involves majorly from weddings and second from the restaurants. And total meals and food support during natural disasters in terms of tons from October 2015 till COVID, during Chennai flood relief, Kerala flood relief, and Nilgiris landslide, almost 554 tons of materials has been supplied by our volunteers during these disasters. Um, and the fourth major impact was measuring the hunger spots in all the 12 cities. We have mapped around 660 hunger spots where we regularly serve food, and we have a regular interaction with the communities in all these 12 cities. And we try to work with them on hunger and malnourishment issues, uh, also involving the local stakeholders and the government. So this was a broad impact during before COVID situation. Now during COVID, obviously it was a very big task to us, because earlier we used to run kitchens only during disasters and calamities, but this was a long running pandemic, and and there was a lot of issues like mobilizing raw materials, mobilizing donations, mobilizing volunteers also. During that initial days of lockdown and initial days of COVID pandemic, it was very difficult to convince volunteers to work on the field, and we were also responsible for their safety. And we did not have any training or any understanding about this pandemic. And I should thank Chris for sharing us the guidelines in the initial stages itself, when we wanted to establish the community kitchen, because earlier government was also not convinced to work with organizations to deliver food to the people in need. So we have submitted some guidelines, and we created a standard operating procedure to run a contactless operation during initial stages of COVID. And I should thank Chris for sharing the guidelines. And with that support, we started establishing community kitchens, that is on a rented place, along with different institutional tie-ups. It is even now it is operational. And initial days, it was very huge task of cooking meals to at least in each kitchen we were cooking meals for 6,000 to 7,000 people, ranging to different kind of beneficiaries like slum dwellers, migrant laborers, and people who moved from nearby villages to cities, and they were not having any transports to move to their villages back for initial 15 to 20 days. So the community kitchen was one initiative, and the second thing was Happy Meal Kit, that is a grocery kit which is having materials of 30 kgs of dry rations, including rice, wheat, pulses, dal, oil, salt, sugar, that was able for them to sustain for at least a month or 45 days for a family of four. And the third thing was frontline workers like sanitary workers, departments in working in the check post, hospital nurses, temporary clinical staffs. So there were no restaurants functioning, and government was also very difficult to finds it difficult to distribute major support systems to the frontline workers. So we started working with the frontline workers, and particularly they are more prone to COVID due to, for example, sanitary workers. They are cleaning the day-to-day stuffs, and when they were handling different kind of waste, they were very prone to COVID-19. So we started working with them to provide immunity kits with Ayurvedic formulations that is recommended by the government also. The immunity kit was given to them. And the fourth thing was migrant laborers, which was a very big issue. People started walking from the major cities to the villages since there is no transport. So we found a lot of people walking on the roads, and there were no restaurants, nothing is open, and people did not get enough food to eat, and they were walking with kids. So we started working with the local departments and created a migrant labor travel kit, which consists of ready-to-eat food materials for 3 days in each kit. And it was given in people traveling in special trains, people traveling on by road, and people staying and moving from one place to other in all the cities where we work. So these are four major things that we did in COVID. When the days passed by, we found another challenge, that the schools are not open and the midday meal program is also not happening. So we started working with the hunger spots, and we wanted to create a meal program. And through the through the temporary community kitchens which we are running, we are identifying kids and serving them on a daily basis. The new project we started 365-day meals to kids. And another interesting thing is we had a lot of festivals during this COVID, but the festivals are not usual. They did not have a lot of happiness like the earlier festival sessions. So for the kids, it will be an issue because when Diwali comes, they definitely need sweets and they should enjoy that, because they will feel that during the older years they have that feeling with them. So we started we started giving them sweets and everything during the celebration times. And since they are not going to school also, some kind of engagement with safety was required, and celebrations were also done with the kids from different communities in need. So during COVID, the impact is the meals have been served to different community kitchens. Um, uh, so it's around 3.86 million meals served in all the cities. Like 12 cities, we have operated the kitchen, and even now in major cities like Coimbatore, Chennai, we have the kitchens running up for the 365-day meal program. Grocery kits, 38,350 families directly reached in all the cities with with the supports from a lot of corporates and GFN, which was very good support for the families. All these families have been directly reached by the volunteers over the period of 6 months. Migrant labor families who have been supported during travel in Chennai, Coimbatore, Hyderabad, and these places include 8,500 families who have been moving from one part to another. Each of them has been given a travel meal kit on their journey. And immunity boosting kits, which was the unique thing which we tried, using the Ayurvedic recommendations from the government, and we procured immunity kits and we distributed to prone and risk areas where the government is declaring the COVID is spreading. So in those areas, these families have been targeted, and this immunity kits have been given. So beverages for frontline workers, from juices and other things for the police and medical care volunteers. 1.2 million bottles have been distributed over the period of 6 months. So now the transformation is, we have been a surplus food network till 2019, and I used to remember 2020 is going to be a visionary year, like Dr. APJ Abdul Kalam, the former president, used to say. But 2020 has given us a transformation to become a food bank. So it is almost 8x of the operations. So 3 more cities also added to our network, and it is 8x of the operation. So it is a very challenging task to the team, and I thank all the volunteers for standing with us in this strong time. And partners, the global partners is GFN Network. With their supports, we are able to distribute the grocery kits, and we are running the community kitchen initiative now. And with the help of GFN, we are going to establish a permanent community kitchen support systems to operate and handle all these kind of pandemics and also disasters. And Siemens Gamesa is also a global partner now. And government partners, all the state governments and local partners, and local food safety department is also very interestingly supporting us. And as Vandana ma'am said, India Food Banking Network has been a key supporting donor to us. They send us a lot of food materials to distribute in our cities, and these were some of the local partners who have been involved. So the post-COVID scenario, we think we wanted to establish this. Currently, the kitchens are operating in institutions and colleges. They are going to reopen in next few days. So we are moving to a permanent setup to run a subsidized meal kitchen program for kids and migrant laborers. We are hoping to scale it up to 10 cities in 2021 December, and establish a food banking facilitation center in the city, where the issue is that the next generation wants to get aware of what food banking is and what is the need of food banking during this kind of pandemic or any very big issue is coming up. So we wanted to create a local facilitation center for at least in a regional level. Many volunteers are now coming to start up their local food banks. So we wanted to support them and create a network with the new people who wanted to start food banks in our locality. So we wanted to create a facilitation center for them. And the no food waste chapters, we wanted to increase to 8 more cities in 2021, which we have currently during the COVID, we had a lot of partnerships and we wanted to increase it to it. So that's all from No Food Waste. I wanted to thank you all for hearing to me. And any questions, I will be happy to answer after the session.
Thank you, Padmanabhan. We appreciate all of that detail. And so now for the last organization, Zomato Feeding India, and Srishti Jain, who is the co-founder of Zomato Feeding India, is going to do the presentation for that organization. So Srishti, off to you.
Yep. Thank you so much, Chris. First of all, good morning to the folks in the US and good afternoon to, our folks in India. I think it was great to know that we're in such good company, especially because, and hearing all the great work that all of us have done, because India has been one country which has been most impacted because of the pandemic, right? Because of the sheer size, population, and demographic. So just starting with before COVID and who we are as an organization. A quick recap. We are 6 years old. We are in 185 cities. We have a strong network of volunteers that pan over the entire country. Till inception to now, we've served a little over 120 million meals, out of which I would say 80% was this year during the pandemic. Our theory of change is that we want to ensure meal reliability to our beneficiaries to ensure that they become self-sufficient and thereby come out of the hunger and poverty cycle in the long term. Before COVID, our main programs were divided into two big chunks. One, which was focused on surplus food, which is, say, a community fridge program or a vehicle program, which used to pick up and donate excess food. And the other one was around children and education program, which focused on giving cooked daily meals in schools, right? Thereby incentivizing their education. So these were the two main categories that we focused on as an organization before COVID. Now, essentially, when the pandemic hit, the biggest challenge that we noticed was all of our food donors, which included events, corporates, weddings, convenience stores, were automatically shut because in India there was a lockdown which was announced, which meant only essential services were allowed to move. So because of the restricted mobility, we only had items for food that could go around the city. You needed a special permit to actually go out on the streets. So all schools, all educational institutes were shut, which thereby meant impacting both our programs. Students could no longer come to school, in a sense that they could not study there and we could not serve them freshly cooked meals. And we do not had offices or organization running from where we could collect surplus food, thereby halting all our programs. On March 23rd, we had a Janta curfew, which was essentially a trial period of 1 day's curfew, which is when we realized as an organization, and the lockdown was not officially announced, but which is when we realized that a curfew like this, a lockdown like this would impact the daily wages the most. Who are essentially daily wagers in India? These are rack pickers, these are auto rickshaw walas, these are people who construction workers who earn every day and live hand to mouth essentially. So lockdown was especially very, very harsh for them because they could no longer go out of their houses to earn for their families, and they literally have zero savings, which is why these were the most impacted people. Essentially, the lockdown was announced at a time when there was no planning done by the government on how goods and services would move, which meant there was a complete halt in the distribution process in the food supply network. And essentially, people were just hoarding to supermarkets to stock on food, any people who could afford them, right? The lockdown was announced on, say, a Monday. On Sunday, we launched the Feed the Daily Wager campaign, which essentially meant that we would wanted to serve communities and families of daily wage earners. We noticed since these people were the most impacted, they were going back home, like Padnamba also said, there was a huge migrant population who was returning on foot. There were people in cities located in slum areas where even social distancing was not possible. What we started on the campaign and what worked for us, I would say, and I'll come to the numbers a little bit later, was the timing. I feel we launched the campaign without understanding and with very, very few, means to understand how the execution would work. Like I said, there were few guidelines issued by the government then. The only guideline that was issued that only essential items were allowed, which essentially meant no volunteers could go on ground. Our magic wheels could not operate as usual. So we decided to follow a model which essentially focused on identifying our key stakeholders. Number one being our supply partners of food, and number two being our network partners of NGOs, which were looking at the beneficiaries. What we did was, and what worked in our favor, is because we have a volunteer network which spans across country, we had an immediate resource on ground. These were the people who could help connect us and identify beneficiaries in their local areas, right? Essentially what happened was that we immediately, when the entire country could not move out, already had a network of NGOs through the network of our volunteers who needed help. And overnight, when we launched this campaign, our email inbox was flooded with requests from people who wanted help. What we did was, after identifying our network supply partners, be it national food vendors who could procure grains in large quantities, we then connected these people to our network of NGO partners, essentially eliminating any other process in the middle, where in a usual case scenario we had to include our vans or our volunteers. These things were now directly transferred from the supplier to the NGO, thereby eliminating any extra hands that touch the material or ensuring sanitization. Like, these are a few pictures that we followed during the entire process. Because there were a huge responsibility on us, primarily because of the nature of funds involved in this project, we ensured a lot of other details. We hired a third-party auditor who would manage all our process. We specially created a due diligence and a quality check team who would ensure that we have every step of the process managed. Number one priority for us was to ensure hygiene and safety, which is why we created these documents and simple guides like I've displayed on the screen in local and regional languages as well, which mention what are the do's and don'ts while distributing a kit, what are the kind of reporting we would need from a particular NGO. This included as detailed things as a complete list of beneficiaries that they would eventually be serving, their social security number, then their families, what are their income status, etc. Our due diligence and quality check team would then call up these beneficiaries on a random sampling to check whether they legitimately received kits or not, thereby completing the whole loop. So our process of procuring from a supply vendor, directly giving it to the beneficiaries through a network of NGOs, and thereby closing the loop of identifying we've given it to the beneficiaries or not, was managed by the entire team. Whereas the first two parts were outsourced to supply and NGO partners, and the third part of due diligence and quality check was done in-house. What we also saw a big challenge throughout the program was that a lot of NGOs were already working on ground, and that led to duplication of efforts. Whereas one family in a village or in a particular area was being given kits by multiple NGOs in the area, which meant that the efforts were not being utilized in the correct manner. So our quality team ensured that once we receive a beneficiary list from people, we thereby segregate based on if they have received anything in the last 2 weeks from us or not, and only then they would be given a particular kit that we had prepared. Our kit comprised of food items for an entire family for a week, a family of 5, and that included dry ration, be it customized on the region. For North India, it was wheat plus some pulses plus some items. For South India, it was rice plus wheat plus some items. What we also did, like I mentioned, we worked with teams on ground and government agencies, volunteers, NGO partners to really get to that local level and each beneficiary in every nook and corner. What really worked for us was the timing of the campaign when it was launched, and which is why we also got a huge coverage pan platforms, be it on social media, be it on newsletters, on newspapers, etc. And that actually led to us collecting funds in a huge manner. So we raised around $4.5 million during the entire duration of the campaign, out of which 70% were raised in the first 48 hours, which meant that a huge consumers, individuals had contributed to this campaign. So even if you look at the breakup of our funds collected, majority of it came from individuals and the remaining came from corporates who gave big pledges. The virality of the campaign and the timing of the campaign was as such that even government schemes were launched later, which I feel really helped us get into and set up our structures in a very nice way. One second. Yeah. So overall, this sums up the impact that we had for the entire campaign, which we distributed over 78 million meals throughout the duration of the campaign, which meant around 750,000 kits to during 851 drives and with the help of 650 not-for-profit partners. This spread pan-India, mostly because we were getting requests from everywhere in the country, and our volunteers were going out, risking their lives, following the safety guidelines and facilitating the distribution process. Like I mentioned, overall in the organization's history, we did 120 million meals, and just 80 of those million meals were done through this campaign. I would say there are two key takeaways from this campaign. One, the timing. When we launched it, how we launched it, how we had covered all loopholes throughout the process, and number two, on how we made the entire program so scalable. It really helped us getting, we actually had a 12 people team, and we had to get pro bono help from volunteers from multiple corporates. And we actually were working with a 60 people team during this campaign, where everyone, irrespective of their designation, their age, was contributing in setting up, say, trackers, to setting up a due diligence team, to setting up quality checks, to randomly calling beneficiaries. So our volunteer network not just helped us in mapping and identifying beneficiaries on ground, but also helping facilitate the entire project by making it more scalable and foolproof. So even if we had, say, additional funding of, say, a 10 million, we could just insert that funding in the same framework and structure, and we would then churn out more meals, right? This was one of the campaigns. Feed the Daily Wager was our biggest, and the campaign that we did during the pandemic. We served, like I said, over 78 million meals and over 700,000 kits in 181 cities. The other program that we also did, and this was actually inspired from one of the conversations that Chris and we were having with a food bank in the US, that a lot of people and a lot of beneficiaries in India were going back to their hometowns. And these are basically migrants. They were traveling by foot, through highways, railway stations, irrespective of what transit points they could find, they were just going back home, right? And they were usually in huge families, disregard for safety, hygiene, because that was the least that they bothered about at that time. We established our Magic Wheels, which was essentially a van that we have, and rebranded it like a food truck. Essentially what happened was we stocked it with all kinds of packaged products that we had got from companies, from various companies, something like a Del Monte to a yogurt company to Unilever, which had everything from biscuits, masks, sanitary napkins, to sanitizer, to chips or cookies. And we had made these essentially, small kits that were pre-packaged that included water, immunity booster, glucose for immediate energy, all of those things. And we'd given them to each family that would survive them over a week for 3 meals each. And we had stationed them at various transit points throughout highways, railway stations, or bus stops. And this, like I said, was inspired from a food truck concept from one of the food banks in the US. Essentially, it was like a food truck of varied brands who had donated to stock up that food truck for, say, a period of 1 or 2 weeks at a particular location.
Srishti, I'm sorry if I could just interrupt.
Yeah.
Can we give like a 2-minute warning? I don't know how much more that you have to go, but just in order to keep us on schedule.
Sure. So now moving on to how we plan post-COVID. Like I mentioned, our surplus food programs are coming slowly back up in terms of activating the community fridges. But our main focus program for this year, keeping in mind the the status of the educational institutions in our country, is that we launched a new campaign which is called Feed Every Child, that focuses on, again, it's on the same lines of incentivizing education for children, for by giving them nutritious meals. The only difference here is, instead of now giving them cooked meals, we're giving them monthly kits to sustain their ration for the entire month, 3 meals a day. We are essentially following the same process, but we've introduced more tech and more ways of transparency in the entire system. Why this shift was, and why we see post-COVID happening, is that the schools will remain closed for a considerable amount of time, and surplus food might not come up with the same zest or with the same number of volume that we were seeing before. It makes logical sense to transit, for a vision of a more reliable means, to transition into serving children who would eventually come out of the hunger cycle in the long run. Just to end that, and giving a summary, we've mapped around 150,000 children that need food support for an entire year, and these are all children going to slum schools. Not government schools are usually helping their children get midday meals at home, but these are all children in slum schools. So for them, maintaining that stickiness with education is even more difficult, since they do not have access to a mobile phone or an electronic device to learn online. So this is our plan post-COVID of moving to and ensuring them more meals for children who were not getting the education that they had before COVID.
Okay, great. Thank you, Srishti, so much. So let's take about 10 minutes or so and address any questions that folks may have for any of the 5 organizations. We can maybe go back to gallery view so everybody can see everybody. I have a question that I would like to throw out to all 5 of you, but especially for those of you who were primarily dependent on prepared foods pre-COVID. You've all had to move into a mode of significant food purchase in order to address your responses to COVID. And I'm curious, at this point, the situation in India, of course, is in a growing mode. You are at this point, I believe it's accurate to still that you are the second most affected country in the world at this point in terms of the spread of the disease, of the virus. So you've had to move into a significant level of fundraising in order to underwrite the purchase of food to enable your response and to take care of your beneficiaries. As you look longer term past the peak of COVID in India, which hasn't been reached yet, and then longer term into 2001, are you confident or are you nervous about the sustainability of that level of fundraising in order to keep that programming going forward? Anybody, just you can unmute your microphone and just respond as you like.
So thank you, Chris, for asking it. When coming to fundraising, the local CSR, the corporate social responsibility funds, are all exhausted from the corporates, and only after March 2021 we'll be able to tap them for the local CSR contributions. So irrespective of the either it is food companies or other industries, Whenever we approach CSR now for the current projects up to March 31st, which is the year-end closure in India, for the year 2020 to 21, it is already exhausted in almost 95% of the companies. So we were not able to raise funds from the local corporate social responsibility. We are, as far as no food waste is concerned, we are currently laying on supports from the donations that we received from GFN and Siemens Gamesa. And we are working with local philanthropists and local donors only. So I think we will face a huge challenge after March 31st. We don't know whether they will be interested to fund food related projects, because they are keen on bringing back education, sanitation and healthcare. I think we see a challenge on that, and I would ask other members also to give us inputs on this aspect, so that we can coordinatively work to raise funds on developing food bank and hunger related issues in India. Thank you.
So can I come in?
Adding to that, like any relief or emergency, the majority of for which is what most of the organizations in CSR did.
Srishti, we're having difficulty hearing you.
Sorry, can you hear me now?
That's better. Yes.
Sorry. Like any other, like I was just saying that like any other emergency situation, the first action that is needed is immediate food relief, which is what most of the companies in CSR contributed to at that time. Now, once things have settled down and it's been a few months of the pandemic and the lockdown, more important and other causes such as education and children not having access to online materials for learning or sanitation or hygiene or support system for other pandemic workers have come up. So the whatever resources that were left at that time are now being redirected to that. Essentially because hunger has been has been sorted. What can be looked at as an alternative for fundraising is individuals, because and what this is also what we noticed is there's a huge giving phenomena and emotion that has come out in the public, and people want to support each other, people want to give back, people who have that privilege. So if not the corporate option, an individual contribution option can be explored and should actually be looked at with more seriousness.
Okay, great. Vandana, I think
I'll agree with what Srishti just said. What we've noticed is that individual giving was not so big in India earlier, but what we've seen during the pandemic is that a lot more people at the individual level want to contribute, and therefore, if we can do a kind of collaborative reaching out to people, individuals in India, all the food banks together, I think we should be able to raise the awareness for hunger issues, malnutrition issues, especially in view of the health crisis, and we should be able to get a lot more of individual funding coming in for this cause.
Okay. And anyone else on that topic? Okay, does anyone else have any questions?
Just want to mention, if people don't want to speak out loud, please feel free to use the chat function, or if you're having any tech issues, please feel free to type in the chat box and we'll try and get to any questions that come in that way.
So I got the opportunity to listen to and meet Tushar for the first time. So Tushar, happy meeting you, and we'll connect offline also and see how we can work together.
Sure, absolutely. Actually, we are the youngest, seeing how much experience you guys have in this field. So, excuse me. So yeah, it will be great to get in touch with anyone and pick your brain.
Good, good. That's one of the goals of the session here, is to to create those linkages. Very good. All right. It's assuming that there are no other questions then, and actually we're down to the last few minutes of our allotted time anyway. I again want to thank you all. As I said at the beginning, we're viewing this as the first of a series of such sessions going forward. The focus today was on giving you the opportunity to talk to each other about what you're doing and what your organizations are about. As you heard from Emily, the work that they did yielded a number of different recommendations in the public policy arena that could be beneficial to the promotion of all of your work around the country. Of course, right now is probably not the right time to be knocking on the door of the national government until we get a little farther through COVID. But it is probably time to start thinking about how to strategize for knocking on the door when the time comes. And so there are a number of different issues that affect all of you and the work that you do, related to the public policy work, related to, as some of you have talked about already, general awareness and partnership development and stakeholder development in order to broaden and deepen your resource bases for ongoing service, not just during COVID, but more importantly, beyond COVID, as you scale your normal, but if we ever get back to normal, kind of operations. And so we would like to suggest that we put together a regularly scheduled series of summits like this in a frequent enough timeline that they can be meaningful and helpful, but an infrequent enough that they're not really interfering with your day-to-day activity. And so I would suggest, and I'd like to hear if you all would agree with this, that we look at an every 6 weeks or every 8 weeks session like this, maybe 90 minutes, maybe 2 hours, depending on what the subjects are for discussion. And that we set out a series of maybe 4 or 5 every 6 weeks or every 8 weeks. And if we're in agreement to do that, then I would be happy to pull together kind of a suggested high-level agenda for what those sessions might look like, and then gather feedback from all of you about where your priorities are so that we can build the sessions to be the most useful to all of you as we work to coordinate and develop the activity of the various food banking systems in the country. Does that seem like a reasonable approach to everyone? Okay, and is 6 to 8 weeks a reasonable timeline if we went with that kind of a schedule? Okay, I see a bunch of nodding heads. So, all right, what I'll do then is within the next week or so, I'll put together a communication to all of you that kind of frames out what that might look like and kind of a proposed set of dates that we can all get into our calendar so that we know that we can hold the time. And then we'll take it from there. Any final comments from your side, Doug?
No, except to thank you all. And I hope that this first meeting, which is really meant to be a deeper introduction with you all, serve that purpose, and then we can begin with deeper drill downs and specific challenges and opportunities that you all see in the country. And in between these series beginning, I would encourage you to send emails to Chris or myself, just letting us know where you see specific opportunities for GFN to be helpful in your strategies going forward until we talk again. Okay. So thank you.
Thanks, Doug. And thanks, Emily, to you and Esther for joining us from Harvard. We appreciate you taking the time and walking us through the atlas and most importantly for the work that you did in India to develop the recommendations that you've made for there. We're looking forward to getting into that. Thanks to our team here at GFN, Tony and David, and to January and Keith for the support in pulling the session together and making it work. We appreciate all of that. And all of the participants, we thank you for being here. And as I said, I'll be in touch with you within the next week or so with some next steps forward. I also want to take a quick second to thank our FBLI sponsors who have been making all of the FBLI sessions possible. Those include General Mills, HEB, Brambles, Cargill, the DLA Piper Foundation, Fundación Lala, and Ingredion. With that, thank you very much. Those of you in India have a good what's left of the evening. And for those of you back here at home, enjoy the day.